Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I'm here with my most favorite co-host, one spectacular Dr. J. Calvert. How are you, doctor?
I'm good. I am doing very well and very excited about our podcast today because it's kind of cool.
Do you want to start over since you just had to take your glasses off?
Not really. I think we should keep going with it. Or should we not keep going?
Sorry, listeners. The topic of today's podcast actually comes from a loyal and avid listener who had a question that she raised and wanted us to discuss. So, Dr. Calvert, will you please tell us what we are talking about today?
I'm going to don my glasses for this part.
You're going to have to put your glasses back on.
I am. There we go. Ready? Here it is. Our listener says, "Hi." I think it's a nice way to start off. I love listening to / watching your podcast with Dr. Rovelo. I haven't seen a podcast on post-breast implant surgery and working out. Would you please cover this in a future podcast, specifically with breast implant revision surgery, with capsulectomy, and pro dancers?
All right. That is actually a very, very good topic. So today we will be talking about the instructions for exercise, dancing, weight, resistance, whatever you want to do after implant placement, whether it's primary or revision implant placement.
Yeah, and I think, primary and revision, you can kind of bring them together. They are. I mean, revision surgery may be a little more complex and may require a little more time. But for the most part, I think the timelines we're going to give are pretty similar.
Yeah. The revision work, especially if you're having a capsulectomy, sometimes involves drains. Sometimes it requires you to have a little bit more physical downtime in the beginning. But usually the time course to getting back to actual exercise is about the same as a primary. And I think this is actually a really good question. I'm surprised that we have not talked about it because it is something I do like to sort of harp on with my patients when it comes to their primary or their revision breast augmentations. And a lot of it has to do with A, the timeline from surgery, but B, also the placement of the breast implants.
Yeah, I think, but still, I even find that it's sort of the same. I tell people with, having their breast implant surgery, if they're, let's say it's a primary breast aug, that, they can get back to exercise of other parts of their body other than their chest and arms kind of quickly. Usually I tell them after about 10 days to 2 weeks, they can do some squats, they can do some walking, they can do some things, but they need to strap their breast implants in place. Either not just the surgical bra we give them, I'd say put another sports bra on over it. Like you need this to really be held in position because you don't want any bouncing, things moving around. You don't want anything that's going to stress the incisions, that you've made to make everything, work in terms of the operation.
Right. You don't want to stress the incisions, but also you don't want to violate the pocket that was created for these breast implants. So a primary implant, you have a pocket, whether it's under the muscle, over the muscle, and it's designed to fit exactly to the exact size of the implant. And similar for a revision breast surgery, you're going to be redesigning that new pocket around the size of the new implant. And you really want a kind of hand and glove match. Otherwise, these implants can flip. They can go out to the sides, under the armpits, if the capsules or the pockets get stretched out. And so that, for me, that's really why I want patients to kind of just lock these girls in and don't let them move for a good 6 weeks. Because after 6 weeks, the tissues are about as strong as they're going to be. So I'm okay with some light activity in those first 6 weeks. Yeah, after like 2 weeks or so, if they want to get out and do some walking or some very, 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 very light lower body work. But I would still be careful even with core work because anytime you're activating anything centrally in your core, your abdomen, you're also going to be activating your chest muscles. So for the sake of just getting these implants to heal as well as possible, just don't push it. You will have time to go back and redevelop those muscles and get back to the gym. But the last thing you want is to have any kind of problems with your breast implant. So this is where I think it's really helpful to just be patient and don't push it too hard because you can create problems if you get back to working out too soon, too early.
Yeah, I mean, that's for sure, especially if you've had like a mastopexy, a lift or something, then, you're talking about stressing these incisions, which you want to heal the
Great.
best they can
Right.
so that the scars are minimized.
Yeah.
If you stress them early, it's not going to work out very well.
It's not going to work out. But once you get into that, 4 to 6 week, I say 6 weeks because 6 weeks is when everything's as strong as it's going to be. You can start getting back into your regular exercise routine, whatever that might be for you. But here's where I start telling people this is where the implants are placed kind of makes a difference. So you can put implants into a subpectoral pocket. That means that it's sitting under the pectoralis muscle. The pectoralis muscle originates around the shoulder area, and then it travels diagonally and inserts into the sternum, into the breastbone. So it's sort of this diagonally shaped muscle that's released, and the implants are put under it. You can also put implants over the muscle, either in a subfascial location, which is over the muscle but under this connective tissue covering called the fascia, or you can put it over the fascia as well and just directly under the breast tissue. And the reason that matters is because if these implants are directly under the muscle, every time you flex those muscles with some kind of chest or pectoralis motion, you are compressing and pushing those implants, and the direction of contraction is going to push them out to the sides, into the armpits. So I don't think that if you have implants under the pectoralis muscles, you should really be doing a whole lot of isolated pectoralis muscles. I just don't think it's a good idea.
No, and it makes sense, right? You've put a medical device there, and now you're going to,
smash it around.
Well, why would you be doing that?
Yeah.
So I think, in terms of I don't want them doing any chest for 2 to 3 months, and I'm pretty clear about that. If it's subfascial, it's a little different.
It's a little different
because you didn't violate the pectoralis muscle, you didn't go under it. And
they
it's
don't
different.
move they move, but not to the same degree.
Right.
That's the whole reason we put implants over the muscle is to avoid an animation deformity, which is movement of the implants with activation of the pectoralis muscles. So,
and there are some weird animation. There's got to be a YouTube video about that. Doesn't there?
There's party tricks. You can one to move and another one to move, but if they're over the muscle, they don't move with the muscle. They just kind of just stay there. So a lot of times this is why people that do competition level weight training, bodybuilding kind of things, they like to have their implants over the muscle because they're not doing these weird animation things. So it depends. And so I say no isolated pectoralis work if the implants are under the muscle. And that even includes things like push-ups. So I just push-ups. And even be careful with the vinyasas that you do with yoga where you're really stressing those pectoralis muscles. It's just support them. This is not the time to go and do, 20 straight full-on push-ups.
That's right.
Get on your knees and do the girly push-ups. Do the supported ones because it will take all of that stress off of the pectoralis muscle. And then you can work out other areas in isolation, the arms, the back, the triceps, but just be really careful and mindful of how much stress you're putting on the pectoralis muscle.
Yeah, those are all the ideas you got to have in mind, and it makes sense. But in terms of I like people to get back to working out because I think it helps them heal.
It does, and I totally get that. It helps with the mental status, and it keeps people sort of just feeling like they're back to normal. So yes, I think that's important.
But
let's
not get crazy.
Let's not get crazy,
and let's be smart about the workouts we do, and that's sort of what I say. And I think that's worked out pretty well. I haven't seen a problem from people getting back to doing some squats or doing some, lunges or whatever. It's just you don't want to be working anything in the chest if it is subpectoral. If it's not subpectoral, then, that is a different story for me. I get them back
in the beginning,
a lot faster. Yeah. 2 weeks, 3 weeks, I say. You can do arms, but you're going to do isolated curls. You're going to do isolated tricep.
Yeah.
Things where you're not stressing the chest at all.
And with 2-pound weights.
Yeah, and nothing over your head. No military press. You just think it through. This is not hard.
We don't need to do this. And then I think the other question that your listener had was actually with dancers, so professional dancers. And obviously this depends on what kind of dancing you're doing, but if you're doing the kind of dancing where you're actually using your chest muscles and you're going against your body weight and you're pulling yourself up and you're spinning yourself around, that's a lot of muscle work. That is a lot of chest work. That's a lot of upper body strength. And this might be someone who would consider doing a subfascial augmentation. Or if they're already under the muscle, consider taking them out and putting them in a subfascial location so that there's not that constant strain on the pectoralis muscle.
Yeah, that's sort of one of my specialty areas is breast implants on competition fitness people. It's been an interesting journey for me in taking care of people that have almost no body fat, a lot of times very little breast tissue. Yeah. How to put breast implants in that don't look like, two, round balls on their chest. You don't want that. You want them to look like, breasts and be pretty and it is a challenge. So some of those do have to be subpectoral, and the ones that can be subfascial, this is where
it's hard because a lot of times these patients don't have any body fat, they need to be under the muscle to give some kind of soft coverage over what's just basically a round implant, and that's for that patient population is very tricky because neither option is ideal.
Yeah, and getting back to the dancers, I mean, I think you have to kind of look at your chest involvement in what you're doing, and if you're doing a lot of
upper body movement,
upper body anything, you have to weight on it, and that's like a 6-week kind of. If not 8 weeks.
If not a little bit longer. That's you gotta hold on that. Although I will say, there are these new developments coming out, which I think is going to be really helpful and has been helpful for patients that have very little body fat, maybe have these subfascial or subglandular implants. There is Alaclay, which we should probably do a whole podcast on this. But previously, if you didn't have a lot of fat, we could use something called Renuva, which is kind of like a synthetic fat matrix that you could inject in areas to stimulate fat growth. But they would come in small syringes, 1.5 or 3 cc syringes. Alaclay comes anywhere from 12.5 up to, I think, 50 or 60 cc's. And it's also kind of a synthetic fat matrix as well. So this is a really great option for women that just don't have a lot of natural fat, but want to have their implants in the subfascial or subglandular plane. It gives a little bit more soft tissue coverage where they wouldn't have it otherwise.
Yes, I've heard about it, as I am a consultant to MTF. Who makes the Renuva product.
Yeah.
I don't use it too much because I don't have a lot of need for it. Typically, the people that I see that need fat need a lot of it.
Right. But that's where this Alaclay is great because it's large volume compared to Renuva.
Yeah. I mean, I haven't seen it yet. No financial interest on either of our parts, but we'll check into it and we'll come back to it for sure. That would be a great podcast to chit chat about.
Yep. I agree.
But these are the sort of the basics in terms of recovery from breast augmentation. Use your brain. If it hurts, don't do it. Be smart about it. And more time is always better in terms of letting it heal. But you got to get back to your life. So there's a balance point. And every plastic surgeon is going to have different criteria than what we've gone through here today. So definitely get on board with your plastic surgeon. Say, what should I do? How should this work? Kind of heard what these, 2 plastic surgeons from Beverly Hills do, but, how about out here in, Arkansas? What do we do here?
Yeah, and they're the ones who know what they did.
Yes.
And so they understand how much time you legitimately need.
Yeah, I think that's really good. I think that's about it. In terms of, somebody also asked me a question today, they said, do you tell your patients that they need to swap out their breast implants at a certain given time? And I kind of don't, but I go sort of by what the company says the warranty is on those implants. They'll help you out with a new implant and some of the OR and anesthesia fees for this many years.
If they're under warranty. So if you go past that time limit, then you're out on your own.
Yeah.
Now, the warranty is if there's a problem. You can't just go and get new free implants because they're under warranty. But if there's a problem and it's been within that warranty time period, which now is 20 years, older warranties were 10 years. So now it's 20 years for rupture and any kind of issues with them. So they're all a little bit different. They all have different provisions. But yeah, I think if you're not having any problems and you're happy with how they look and they're not causing you any problems, then you can go up to the length of the warranty.
I think that's the message to me. If they say 20 years, then I'm like, well, maybe start thinking about it after 20 years. But the real answer to that is, you're going to continue to age. Your body's going to continue to age. So when they need an update, they need an update. That's
what
it.
I say the same thing. I'm like, usually people end up swapping out their implants before they hit the end of the warranty for cosmetic reasons.
Yeah.
Time, age, gravity, pregnancy, childbirth, menopause, weight gain, weight loss. There's usually a cosmetic reason that requires these implants to be updated, not a medical device issue.
Right. So that's kind of on you to stay in touch with your plastic surgeon and, and 20 years is a long time.
It's a long time.
Like 20 years from now, I'll these will be your patients. At that point, they're not going to be mine. I hopefully will be, have my pants, halfway up my chest and playing shuffleboard on a cruise ship somewhere in 20 years. But
I hope so for you as well.
That would be awesome. If I can make it to that kind of an age, it'd be great. But at the same time, you want to stay in touch with your plastic surgeon and get their opinion.
Yes. I agree.
It's a great question.
Yes. So thank you again. We always love getting these questions from listeners. So if there's anything out there that we have not covered or that you want us to go into more in depth, please feel free to reach out to either of us through our Instagrams or on the YouTube, and we will try and make those answers happen.
Without a doubt.
Absolutely. So with that in mind, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.